Starting this Saturday, there is something happening. You're going to make sure that insurers are covering the at-home tests for free. And this is important for people to understand because I know that equity has been a big push, the vaccine equity, the idea of vaccine diplomacy worldwide, but also what's happening here domestically. So how is this going to help to sort of help in those costs? These are expensive tests, right?
Well, and the cost should go down. And so what the president has said is that one way or the other, if Americans want to get tested and we want them to be tested, we're going to make them available. So first, the president has said that where you have private health insurance coverage and you go out and buy a test, you should be able to get reimbursed for having bought that test, the rapid test, if you want to do it at home. Secondly, the president said, well, we know some folks in America are not yet insured. And so for those folks, through our broad span of community-based clinics, health clinics that we have in America that are certified by the federal government, we will make 50 million of these tests available for free. So if you don't have insurance or if you haven't been able to access them in any other means, you can go to one of these clinics and access that test for free. That's
Yeah.
on top of now what the president is saying that coming soon through a website that will be established shortly, we're going to try to make available up to 500 million tests to Americans for free. In fact, this week the president announced he's going to boost that up to a billion tests over the course of the next several months. So he's doing everything he can to make sure that, one, we have all the vaccines we need, two, we have the tests we need, three, we have the therapeutics we need, and four, we got to make sure people are masked as well. We're going to do everything we can to help there.
I mean, the costs are ridiculous. I mean, I know I ordered the KN95 mask for my children. It was going to take 10 days, costing $68. I remember the price for like 25 masks. And the idea of thinking about the cost of the testing, I mean, for those lucky enough to find the tests you're talking about, they range from 10 to 50 bucks a pop. And you're talking about the amount of times you have to actually do it. It's very important. And one of the concerns people have, and I'm not going to, undermine the fact that this is being done right now, but there is a question from people as to why is it just being done now? I mean, this was foreseeable because you went from vaccine, curious to then vaccine hesitancy to vaccine reluctance to really vaccine refusal. So we knew that it's going to be an issue to have this still lingering in our society. Why weren't the actions sooner? Can you explain?
So remember, Laura, that unlike the vaccine, these tests have been available for quite some time. In fact, the PCR tests, which are the tests that you send into the lab to get the results, have been available for quite, and they were sitting around. People weren't using them. But what's happened now is Omicron, including people who are vaccinated, like you, like me, are getting tested and want to get tested. And the result is you have a much higher demand. And so the commercial market where these tests have been available hasn't kept pace. And the president said that's unacceptable. The commercial market, which is supposed to be able to meet demand, hasn't done so. So what he has done is he has put the force of the federal government behind the effort to try to get us those masks faster, whether it's by getting people reimbursed for those they buy commercially or by making them available, as I said, either through these community health clinics or through the process of getting 500 million new tests out there very quickly over the next several weeks and months to people who want them and go online on a website that will establish very, very shortly.